Starting.
Yeah, go. Okay, sit down first.
Okay. Whenever you're ready,
When you're ready,
Stockton.
just give me a point.
Okay, should I move
Point at the
this
camera.
one then too? Or do you want to move that
I'll
one?
move that one for you too.
Okay,
We'll make some tape. Okay,
that's good.
go ahead.
Hi, my name is Dr. Katie Palmer, and I'm a physical therapist here at Performance Spine and Sports Medicine, and I'm here today to talk to you about the different causes of neck pain as well as the different physical therapy treatment principles that we use here at Performance Spine and Sports for patients with neck pain, as well as I would like to explore the McKenzie diagnosis and treatment plans for patients with neck pain. So let's begin by discussing a little bit about neck pain. So neck pain can be debilitating depending on the severity of symptoms and the cause of the pain. It affects about 2/3 of the population of people at some point in their life, and those people with neck pain experience a low to moderate disability on a daily basis. But it may cause severe disability in those patients where their pain is more chronic. Neck pain does not always, however, just affect the neck. It can also affect a person's upper back, their shoulders, their arms, or their hands, because an injury to the neck can cause radiating pain to these areas. Neck pain can also be exacerbated by emotional stresses or physical stresses, such as those caused by poor posturing that is common in everyday life. So our next slide shows the current research as far as neck pain is concerned. So the prevalence of neck pain is 67 to 71% of the population are affected. About 10% of cases become chronic. Over $85 million a year is spent looking for relief from back and neck pain. And there is no evidence of association between degenerative changes and persistent pain levels. So what this means is that just because somebody has degenerative changes on an x-ray, that's not necessarily what's the pain generator or what's causing the pain. So what we do here in physical therapy is try to find out what is causing the patient's pain. So let's look at the anatomy of the neck a little bit. So we have 7 vertebrae in the neck, and they're named from C1 to C7. And the vertebrae in the neck are called the cervical spine. And the vertebrae are the bones that make up the neck. So in between each of the vertebrae, we have discs that help to cushion the bones of the spine. And these discs are made of mostly water and nutrients, and they're used as the shock absorber of the spine. The bones of the spine and the discs help to protect us from the everyday stresses of life and help to cushion and protect the spinal cord as well. So this is an illustration of the common pain locations in somebody that has a neck injury. So patients, again, like I said before, patients with a neck injury may or may not have neck pain, or they may have other associated symptoms. So they could have pain coming down the side of their arm or in their upper back and going all the way down into their hand. So just because a patient is having pain in their shoulder or pain in their hand doesn't necessarily mean that their pain is coming from that area. It could be coming from the neck. So sometimes patients are confused when they're being treated. They're having pain in their shoulder or their hand, and they're having exercises done for their neck. Well, that's because the injury may be in the neck and causing that radiating pain. So some causes of why we may get neck pain stems from the poor posture that we have over the years. So unfortunately, most people spend their days sitting at a desk or typing on a computer. And because of prolonged sitting, gravity over time starts to make it harder and harder for a person to stay upright. So it causes this slumped posture over time. And this puts a lot of strain on our spine. Our sleeping posture can also affect whether or not one will wake up with back or neck pain, because of the different postures that we use with the amount of pillows that we use and things like that. So over time, these bad habits become harder and harder to break. So I want to discuss a little bit about the McKenzie theory of neck pain. So this is one of the methods that the physical therapists used here at Performance Spine and Sports Medicine to treat neck pain. So according to the McKenzie method, a majority of neck pain can be resolved by performing a set of specific exercises. So these exercises would be determined by your physical therapist, and they are patient specific. McKenzie also emphasizes the importance of proper neck and back postures throughout the day in order to correct these poor postures that have caused this neck or back pain over time. So according to McKenzie, the goal is for the pain to centralize and eventually abolish. So the principle of centralization, what that refers to is the pain coming from a more distal site or a site that's further away and having it come more central. So for instance, if a person is having pain in their lower arm or into their hand, the principle of centralization would mean that after doing a set of specific exercises, the pain eventually starts to only be in the upper arm or in the shoulder or just in the neck, and it's no longer in the lower arm or in the hand. So that would be the principle of centralization. So the goal is for the pain to centralize and to eventually abolish. So there may be, if there is any sort of increase in pain intensity at this central point, that's okay, but the symptoms should never peripheralize, meaning that the symptoms should never go further down the arm than they originally started. So the McKenzie classification of neck pain that includes derangement, dysfunction, postural syndrome, and there's another category as well. So most patients with neck pain are mechanical neck pain patients, and what that means is that a person is able to change their pain according to the positions that they're in and according to doing different specific exercises. So most of the patients, according to McKenzie, fall into a derangement category. And a derangement is better known to people as a herniated or a bulging disc. So most disc issues are able to be resolved with a set of specific exercises as well as posture modifications. So since most people fall into the derangement category, I want to describe a little bit more about what a derangement is. So a derangement describes any kind of internal disruption going on within the joint tissue or within the discs of the spine. And they're more commonly known as a herniated disc, or a bulging disc can also be referred to as a derangement. So we describe a disc like a jelly donut to our patients. So when a disc herniates, that's when the jelly is coming out of the donut. So when that jelly comes out of the donut, it can impinge on the surrounding nerves of the spine in the neck. And that's why it can cause this radiating pain going down into the upper back, into the shoulder, and down the arm because of its effect, the jelly and the donut, its effect on the nerves. So physical therapy can help by using specific exercises and posture correction to help push this jelly back into the donut. So these can help to provide relief from neck pain, upper back pain, shoulder pain, or arm and hand pain that may be coming from the neck. So it is recommended that you see your local physical therapist for a proper evaluation and assessment.